Hello everyone, my name is Hamza Hasni and I welcome all of you to the Hind Guru Academy. Today we are going to practice a passage. We are going to understand comprehension of passage for MBA entrance examination, and today I have a passage from the previous year question paper of MBA entrance examination Jamia Millia Islamia, right? So this is a passage that we are going to understand and we are going to solve. Okay, so what is the direction here? The direction for question number 49 to 53 is answer the questions that follow on the basis of the reading of given passage. So every time the direction is close to same, right? You have to read the passage, you have to comprehend it, you have to understand what the author is saying, and then you have to answer the question. So this is a passage that you have to learn means you have to understand. Okay, I start the passage. Anxiety is a hot issue in psychiatry now. What is the first line? What does it say? The first line is saying to us that anxiety means worries, tension, is a hot issue. Hot issue, something is hot means something that is going on. That is the newest form, right? So it is going on, it is present, it is the newest issue in psychiatry now, right? So the first sentence is saying that anxiety has become the latest and most important and most what we can say most common issue these days in psychiatry. All right, move ahead. In the 1960s, now we are talking about past. The hot topic was schizophrenia, right? It's schizophrenia. Although we don't have T here, but it is pronounced as schizophrenia, sorry. And it happens with many words in English. Like you say pizza, but that is not pizza, that is pizza. Pizza. We don't have T in pizza, yet it is pronounced as pizza, right? So similarly, this word is pronounced as uh, schizophrenia. Schizophrenia, right? And in the 1970s, it was mood disorders, depression, and manic depression. And now it is anxiety disorders. So in 1960s, the most important topic was schizophrenia. In 1970s, it was mood disorders, depression, and manic depression. And now it is anxiety disorders. So what is the most common problem, most common issue in psychiatry now? Anxiety disorder. Okay. This is not necessarily because there is more anxiety around. Passage is condemning this thought. If we think that anxiety is very common, it is all around us. So the passage is condemning this thought and saying this is not necessarily because there is more anxiety around. Anxiety is a hot topic not because it is common around us. This line wants to tell us although anxiety is a common topic, hot issue, but although it's hot issue, yet it's not important, it's not necessary that it can be found everywhere around us, right? So not because there is more anxiety around. As one psychiatrist has pointed out, researchers tend to gravitate toward research dollars. And an anxiety research is very popular among pharmaceuticals houses that sell tranquilizers. Now, what does this sentence mean? One psychiatrist has pointed out, he has checked it, he has made it clear. Researchers tends to gravitate towards research dollar. The researchers who try to make their research on these things like mental conditions like anxiety, they always have in their mind that they have to earn a lot of money. They want to make money. This is why they are researching. They always have an open, what we can say, an open uh, greed for money. That is why they are performing their researches, right? And an anxiety research is very popular among pharmaceutical houses. Research on anxiety is popular among those companies who are producing drugs that sell tranquilizers. Tranquilizers are drugs that are given to the people who are suffering from anxiety, the medicine that calms them and the medicine that helps them in sleeping, right? That is called tranquilizer, and that you cannot avail yourself of very easily, right? Because you must have a prescription from doctor before you buy a tranquilizer. So this sentence means researchers perform their research on anxiety so that they can earn money, because it is very popular among those medicine uh, ph- uh, pharmacies uh, which sell tranquilizers, right? So money is one reason for all this interest. So this interest, which interest? We are talking about the interest of research on anxiety. So for this interest, money is one reason, right? They are performing research because of money. Another is surely the revolution that has taken place in recent years in the way anxiety is defined and diagnosed. Okay, although we have learned from this line that money is a reason, yet we have another reason. We cannot say money is the only reason that researchers are performing research on anxiety. Money is a reason. We have another reason, and it is surely the revolution that has taken place in recent years. So, recently, there is a revolution in which the anxiety is defined in different ways. It is diagnosed in different ways. Means anxiety has a lot of types. It can be diagnosed in different ways, right? So that is also a reason that researchers are performing research, right? Each anxiety disorder is now described with great precision in terms of symptoms, which theoretically enables doctors to study and treat the disorder more scientifically. Each anxiety disorder means there are many anxiety disorders, right? So we are talking about each anxiety disorder is now described with great precision. Today, we must have very accurate knowledge of the type of anxiety disorder. So each anxiety disorder is now described with great precision in terms of symptoms, which theoretically enables doctor to study and treat the disorder more scientifically. So you must have a knowledge. Researchers must have performed research on the types of anxiety and give the accurate knowledge, give the accurate information about the symptoms, about the things, about the conditions, so that doctors may study and treat the disorder more scientifically, right? Anxiety may be of different types. Suppose a doctor is trying to treat someone who is suffering from anxiety and he doesn't have accurate knowledge of the type of anxiety. He is trying to treat him in the similar way he has treated many of his patients, but he is not succeeding in treating him. Why? Because he had not what? He had not learned more about the type of anxiety. He is not, aware of the special kind of treatment that the patient needs, right? So for that, each anxiety disorder is now described with great precision in terms of symptoms, which makes doctors study about the disorder and treat them more scientifically. The old grab bag term anxiety neurosis, which covered all sorts of anxiety behavior, has given way to diagnostic descriptions of specific forms. Here, S is extra, so just forget it. Specific forms of anxiety, phobia, panic states, and new favorite of the researchers, post traumatic stress disorder, PTSD in the trade, which has been much in the news. PTSD is cluster of symptoms suffered by people who have been thorough deeply traumatic experiences. Okay, now what? The old grab bag term anxiety neurosis. There is a term that is very famous, that is an old term. Anxiety neurosis means the anxiety which occurs because of fear. Somebody has gone through fear. That may be of any kind of fear, right? So, because of fear, he is anxious, right? Which covered all sorts of states. So, when we talk about anxiety neurosis, means anxiety due to fear, it covers all sorts of anxiety behavior. Means all kind of anxiety comes, all kind of anxiety, kinds of anxiety come under this term, anxiety neurosis. Has given way to diagnostic description of specific forms of anxiety phobias. What has it done? It has given way to diagnostic description. Means one term is there, what? Anxiety neurosis. All the other terms come under this, and you can specify forms of anxiety, phobias, panic states, and new favorite of the researchers. Now, there is another state that has become favorite of the researchers, that is post traumatic stress disorder, PTSD, which has been much in the news. That is very famous nowadays. PTSD is a cluster of symptoms suffered by people who have been through deeply traumatic experiences. So, post traumatic stress disorder is found in the people who have experienced a lot of fear in their past life. So, you must have heard some news like somebody was captured somewhere for a long time, and when he was anyhow escaped, he was found in anxiety, and he was found in the condition what? Post traumatic stress disorder. So when someone has experienced trauma, he has been through trauma, he suffers from this condition. The obsessive reliving of these experiences, typically in dreams and memories, is the central symptom of the disorder, according to Dr. Elizabeth A. Brett, an associate clinical professor of psychiatry. Okay, so what these people do, although they have come out of their trauma, but somewhere in their memory, in their mind, they relive the same life, or maybe in dream, maybe in their thoughts, right? So they relive that life, that fearful life. Okay, so the obsessive reliving of these experiences, typically in dreams and memories, is the central symptom of the disorder. Due to this, they have that anxiety. They are reliving the same life, same trauma that has passed, that is in their memory, right? So Dr. Elizabeth A. Brett tells us that this is the reason that they relive, right? And who is Dr. Elizabeth A. Brett? An associate clinical professor of psychiatry. This is the first system. Okay. She describes other symptoms. Now she is describing other symptoms also. The startle response. You are hyper vigilant war veterans. Next is the startle response. Somebody starts behaving in a different way. Like, suppose someone is hyper vigilant war veteran, right? Somebody has gone through a war, right? If they have a helicopter, will hit the ground and always stand with their backs to the wall in crowded rooms. So what happens with them if there's a helicopter nearby? If they hear the noise by a helicopter, they will hit the ground, behave in a strange way. Or what will happen? They will always stand back to the wall. Means they will go near a wall and they will just what? Lean on the wall. They will just try to hide themselves, right? In a crowded room. Numbing sensations, becoming more emotionally constricted. They will be constricted. Means they will what? Constrict means becoming lesser and lesser, like uh, occupying lesser space, right? So they'll try to just hide themselves. Trouble sleeping, they will have trouble in sleeping. Psychological responses, sweating, clamminess, stomach upset to anything resembling the original event. Okay, so these are the things that may happen with them. Okay, wait a moment. Hmm. Hmm. So their responses may they may sweat, they may have stomach upset, clamminess, right? With these events, right? The range of victims of PTSD is as broad as the sordid spectrums of contemporary stress. So, as much as they are in stress, they'll respond in strange ways, in strange manners, right? Survivors of natural disasters, survivor of terrorist attacks, witness to horrors, victims of child abuses, rape, kidnapping, all these have been studies down to the nub of their anxiety. So, if anyone has witnessed these things, let it be natural disorder, terrorist attack, witness to horrors, victim of child abuse, rape, kidnapping, etc., that will, they people who have witnessed this will feel that kind of anxiety. But nowhere in any of this or in current research of any other anxiety disorder is there ever talk of neurosis. But in all kind of these researches, current researches on anxiety disorder, they don't talk of neurosis. Earlier theories had it that anxiety usually emanates from neurosis. Earlier theory said that yes, it is due to fear. But now in present researches, they say that isn't fear, but that is what? That is past experiences that remains in our memories. I never once heard the word and am told that it does not even appear in uh, psychiatry's Bible. Dr. Elizabeth A. Brett is all speaking. She says that I never once heard the word, this word, neurosis, she never heard, and she thinks that this word doesn't appear in psychiatry's Bible. The revised edition of the Diagnostic and Statistical Manual of Mental Disorders set forth with this new diagnostic precision. Instead, they now speak of vulnerability. Some of us are simply more vulnerable to anxiety than others. Okay, so now she's saying that the revised edition of the Diagnostic and Statistical Manual of Mental Disorder is set forth with this new diagnostic precision. Means they have a new diagnostic now. They have new treatment. They have new researches, right? Instead, they now speak of vulnerability. They don't say that it is due to neurosis. They say it is vulnerability. It is weakness that we are so open to anxiety, right? Some of us are simply more vulnerable to anxiety than others. Means anxiety may harm us. Some of us are more vulnerable. Means some may get into anxiety more easily than others, right? Because of a complex interaction of psychology, biology, past experience, and stressful events. So, some of us are more exposed to anxiety. Anxiety may harm them more easily because of their past experiences, their physical health, mental health, and other things, right? The first three belongs to us. The events which figure hugely in the theory are the luck of the draw. And all these three things, psychology, biology, and past experiences, stressful events, more important thing is the events that has happened us, that keeps the main role in the theory, and that may affect us, right? This is the main thing that we have learned from this passage. Now we have questions. So first question from this passage is, one of the following is the study and treatment of mental diseases. So according to the passage, which one of this is a study and mental treatment? So are we talking about psychosis? Are we talking about psychometry, psychiatry, or psychotherapy? Obviously, we have learned the passage and we know the passage is talking about psychiatry. So the answer would be C, psychiatry. This was a very simple question. Usually they don't ask such questions in MBA entrance exams, yet it has been asked in Jamia Millia MBA entrance exam, right? So C is the right answer here. Now move to the next question. More research is done in anxiety disorders at present because the modern people have to live in anxiety all around. The first option can be cut, can be declined only by this one line in the passage. Which line? What I was saying, that only one line can decline the first option of the question number 2, second question, right? And that line is researchers. No, that line is here. Okay, this is not necessarily because there is more anxiety around. Means the passage is declining that we have anxiety around. It is saying that researchers are doing this because they want to earn money, right? So, for this question, we can easily understand the answer should be more research is done in anxiety disorders at present because the modern people have to live in anxiety or not? No. Researchers are keen on making money? Yes. This is the right answer. The doctors want to analyze precisely the symptoms of the disease. That may be a reason, but that is written so simply and so practically there. To give some provision for unemployed doctors, this is not written everywhere. Okay. Next question. The best way to treat patients with anxiety disorder would be option A, to find out precise ideas about who get anxious and why, to study and treat the disorder more scientifically. C, approach a psychologist D, none of this. None of the above. Okay. So, first of all, you should cut this one because we have never talked about a psychologist in the passage. Uh, the answer may be A or B or D. Let us search. Okay. So, what we have learned here in the passage, moving to the passage. Okay. Hmm. I want to show you one line here. This line. Okay. Mhm. Getting set. Okay. So here you can easily see that the passage is saying each anxiety disorder is now described with great precision in terms of symptoms, which theoretically enables doctors to study and treat the disorder more scientifically. So, what is the best way to treat anxiety? To treat it more scientifically, right? So, this should be the answer to that question. Let us move there. Okay. The best way to treat patients with anxiety disorder would be to study and treat the disorder more scientifically. This is the right answer here, right? Next question 52. The most important symptom of the disease of mental disorder is hitting the ground on hearing a helicopter. That may be reliving of traumatic experiences. C. Perspiration of stomach pain. And D. Mental happiness. C. These two are the symptoms, but the doctor said most important symptom is they are reliving in their past life in their traumatic experience, right? So for their traumatic experience, they are never out of it, and this is why they behave in a different way. The trauma lives somewhere inside them. This is the main symptom. Okay. Okay. Now I think there's a last one here. Hmm. Question number 53. The word vulnerability as used in the passage means option A, liable to higher penalties. B, that may be wounded being exposed to damage by a weapon or criticism. C, the quality that makes a person behave in a very criminal manner. D, the characteristics of one having coarse manners to low taste and unrefined expressions. Okay, so in the passage, the word vulnerability was there when we learned the last, I think, last sentence or second or third last sentence. It was saying that some of us are more vulnerable to anxiety because of their past experiences. Means they can be easily damaged by anxiety because they have their traumatic experiences, right? So, vulnerable is something that may be wounded, being exposed to damage by weapon or criticism. B is the right answer here. So, I have solved this one passage for you, and I have tried to teach you how you can solve the passage, how you can decode every part of the passage, and you can understand the questions and the options to answer. Right? Yesterday, I taught you the points that you have to keep in mind, and today we have practiced the point. Now we have another passage in this uh, previous year question. Although last year paper is mentioned there, but it is not last year paper. it was asked in 2016, right? So it is for your practice only. We have another passage. So this is on you. I'm leaving this passage on you. You have to practice this passage and you should try to measure your knowledge, your comprehension about passage, right? So go through the passage, try to solve the questions, and if you need my help, you may ask me directly. I'll tell you, I'll I'll let you feel free to clear your doubts with me, and I'll obviously let you know how to do it more easily and more efficiently, right? So here I conclude the class and we'll meet in another class. Thank you very much.